untreated heartburn or acid reflux can lead to cancer, which is pretty crazy. If you want a way to force your body to permanently stop acid reflux and heartburn in 48 hours, click the link in the description below. For now, let's get to today's question.
The question: what causes anemia in Gerd? What is Gerd? Gastroesophageal reflux disease, or Gerd, occurs when the acidic gastric juices from the stomach flow up into the esophagus. As these juices are allowed to flow into and irritate the lining of the esophagus, a burning sensation is felt in the lower chest. If these symptoms of heartburn are not controlled with modifications in lifestyle, and over-the-counter medicines are needed 2 or more times a week, you should see your physician. When Gerd is not treated, serious complications can occur, such as severe chest pain that can mimic a heart attack, esophageal stricture, the narrowing of the esophagus, bleeding, or a precancerous change in the lining of the esophagus known as Barrett's esophagus. What are the causes of Gerd? One possible Gerd cause is the weakness of the muscle at the base of the esophagus that connects and controls the flow of food into the stomach, known as the lower esophageal sphincter, LES. As food travels down the esophagus, the sphincter opens to let food flow into the stomach. Normally it closes as soon as the food enters the stomach. With heartburn, the sphincter does not close tightly. This allows stomach acid to flow back up into the esophagus, often called acid reflux, causing a burning sensation. Other causes include excess acid production and other diseases that interfere with food passing through the esophagus. Gerd symptoms. Frequent heartburn is the most common Gerd symptom. However, patients may also experience some of the following: sour or bitter taste, bitter stomach fluid coming into the mouth, especially during sleep, hoarseness, repeatedly feeling a need to clear the throat, difficulty swallowing food or liquid, wheezing or coughing at night, worsening of symptoms after eating, or when bending over or lying down. Diagnosing Gerd. Diagnostic tests for Gerd may include upper GI series, a series of x-rays of the upper digestive system taken after drinking a barium solution, 24-hour pH monitoring, a probe placed in the esophagus to keep track of the level of acidity in the lower esophagus. This is done over a 24-hour period. Manometry measures muscle pressures of the lower esophagus, LES. Endoscopy, looking at the esophagus and stomach through a thin, lighted flexible tube that is passed down the throat. Biopsy, removing a small sample of esophageal tissue to measure the amount of acid or pressure in the esophagus. Gerd complications. Heartburn can feel like the pain associated with a heart attack. Never assume that chest pain is heartburn or indigestion. Seek medical care if you're not sure. Complications occur when Gerd is severe or long-standing. Constant irritation of the esophagus by stomach acid can lead to inflammation, ulcers, and bleeding. Anemia or low blood count may develop. Over time, scarring and narrowing of the esophagus can also develop, making it difficult to swallow and pass food through the esophagus. This narrowing is called a stricture. Some patients develop a condition called Barrett's esophagus, which is a serious change in the cells lining the esophagus. Barrett's esophagus may be a precursor of esophageal cancer. Gerd prevention. Certain diet and lifestyle choices can contribute to the condition. For example, certain foods increase acid production, and fatty foods increase the time food remains in the stomach. Chocolate, peppermint, coffee, alcoholic beverages, and especially nicotine and cigarette smoke weaken or relax the lay. Obesity places added pressure on the upper abdomen, and during pregnancy the lay weakens for unknown reasons. Gerd treatment. When symptoms of heartburn are not controlled with modifications in lifestyle, and over-the-counter medicines are needed 2 or more times a week, or symptoms remain unresolved on the medication you are taking, you should consult your physician. Treatment should be designed to 1. Eliminate symptoms, 2. Heal esophagitis, and 3. Prevent the relapse of esophagitis or development of complications in patients with esophagitis. In many patients, Gerd is a chronic, relapsing disease. The goals of long-term maintenance are to control the symptoms and prevent complications. Maintenance therapy will vary in individuals, ranging from basic lifestyle modifications to prescription medication as treatment. A proven holistic 5-step system for curing acid reflux and heartburn and achieving lasting freedom from most digestive disorders. Click to access your free download.